Gastroenteritis spreads easily through various routes, making hygiene practices crucial in preventing its transmission. This highly contagious condition can affect anyone, regardless of age or health status, and understanding its transmission is key to controlling outbreaks. The most common mode of transmission is the fecal-oral route, where contaminated feces come into contact with the mouth. This can happen when individuals do not wash their hands properly after using the restroom and then touch their mouths, or handle food that others consume. This can occur through direct contact with an infected person or contaminated surfaces. For instance, shaking hands with someone who has not washed their hands after using the bathroom can transfer the virus. Similarly, touching doorknobs, light switches, or other common surfaces that have been contaminated can also lead to infection. Food and water contaminated with the infectious agents are significant sources of outbreaks. Contaminated water can be a major issue in areas with poor sanitation, where sewage can seep into drinking water supplies. Similarly, food can become contaminated during preparation if proper hygiene practices are not followed. Improper food handling, inadequate cooking temperatures, and contaminated water sources can all contribute to the spread of gastroenteritis. For example, raw or undercooked poultry can harbor harmful bacteria, and if not cooked to the right temperature, these bacteria can cause illness. Additionally, food that is not stored at the correct temperature can become a breeding ground for pathogens. It's essential to practice safe food and water hygiene to minimize the risk of infection. This includes thoroughly washing fruits and vegetables, ensuring that meat is cooked to the appropriate temperature, and using clean water for drinking and cooking. In areas where water quality is questionable, using water filters or boiling water can help reduce the risk of contamination. Close contact in crowded settings, such as schools, daycare centers, and nursing homes, facilitates the rapid spread of the infection. In these environments, individuals are in close proximity to one another, making it easier for the virus to spread from person to person. Children, in particular, are more susceptible due to their developing immune systems and tendency to put their hands in their mouths. Good hygiene practices, including frequent hand washing and disinfecting surfaces, are paramount in these environments. Regularly cleaning and disinfecting high-touch surfaces, such as doorknobs, light switches, and toys, can help reduce the spread of the virus. Hand washing with soap and water for at least 20 seconds is one of the most effective ways to prevent infection. In situations where soap and water are not available, using an alcohol-based hand sanitizer can be a good alternative. If you or someone you know is experiencing symptoms of gastroenteritis, such as diarrhea, vomiting, and stomach cramps, it's important to seek medical advice. Early diagnosis and treatment can help manage symptoms and prevent the spread of the infection to others. Staying hydrated and following your healthcare provider's recommendations are crucial steps in recovery. Community education and awareness are also vital in preventing the spread of gastroenteritis. Public health campaigns that teach proper hand-washing techniques, safe food handling practices, and the importance of clean water can make a significant difference. Providing access to hygiene kits and clean water sources in underserved areas can help reduce the incidence of this illness. By practicing good hygiene and being mindful of how gastroenteritis spreads, we can protect ourselves and our communities from this common but preventable illness. Teaching children the importance of washing their hands and maintaining cleanliness can instill lifelong habits that contribute to better health for everyone.